Welcome, Emily Fasciana, to the Dish with Dina podcast. Thanks so much for joining me today.
Thanks so much for having me. I'm so happy to be here.
I'm happy too. We were just chatting about how we are connected. Do you want to tell our audience how we know each other?
Yeah, so my friend Mickey was on your podcast a couple shows ago, and we're starting a podcast. So I figured, why not chat with Dina and see how I could get on this podcast realm a little bit more.
Learn all of the ins and outs and whether or not you actually want to do it. I'm
That's
kidding.
right.
I'm going to actually tag Mickey's episode to
Yeah.
this if anybody wants to go back and listen to it. So, we do have being a dietitian in common. My episodes don't always include guests who are dietitians, more along the lines of the general health and wellness space. But can you share with our followers, listeners, viewers at this point too, if you're watching on YouTube, share with us a little bit about where you were and how you got to where you are now?
So I started my undergraduate degree at Bowling Green State University, got my bachelor's in dietetics there, and then very competitive at that point in time, getting an internship, getting matched to an internship, very similar to how medical residents get matched to their programs. So I moved 8 hours away from home to Scranton, Pennsylvania, where I went to Marywood University and completed my master's degree, my dietetic internship there. My master's is in sports nutrition and exercise science. And since then, I have been out here. I took my dietitian registration exam, passed, and been out here since in northeastern Pennsylvania. And I've done quite a bit since then. I've worked at a YMCA doing counseling. I have been a school food service director, and that was kind of my dream job. Then the management kind of came about, and I was a young dietitian, wasn't really ready to step into that yet. So then I found my current job where I've been for the past 8.5 years now, working at a healthcare center in more outpatient uh, the the outpatient arena, and I work specifically with the oncology population, but I've also worked with weight management, any other kind of general outpatient eating disorders even. And then I also have worked in kind of our food security programs that we've had there too.
And this just goes to show that not just our profession, but a lot of professions too, there might be a variety of different channels or specialties that people can get into. And also what comes about either organically, what you might learn as you're going through your first few years of your career, or in our case, the internship, I think, also provided us with a lot of experiences that showed us maybe what we did not like about the profession and what we did like about the
Yes.
profession. If you did you know when you got into the dietetics world, did you have an idea of what you wanted to specialize at the time? Like what came about that discussion in your head or with other people? And, obviously now you've navigated into maybe different directions, but what kind of threw that into your brain of why you even wanted to get into dietetics to begin with?
Yeah, so I remember specifically reading a article in high school on blueberries, and that just the antioxidants in there, that just drew me in, the science of it, the chemistry of it. Not that I'm such a sciencey background girl, but or did I do great in bio, but that kind of just drew me in and I said I want to be a dietitian. So when I went into that, I more wanted to be in the outpatient aspect, community aspect. I wasn't, as I mentioned, too into the science of it. I mean, of course, that's what our profession is based off of, but I didn't do so well in school on that. Okay, so we're not all perfect here in dietetics, but I really wanted to go into that outpatient aspect, the counseling, kind of the psychological aspects of the counseling spoke to me. I remember in undergrad sitting through some of my medical nutrition therapy classes, and I'm like, I don't really know why I need to dive too far into this. I'm not going to get into it. And then here I am in a very clinical role in oncology. And I forgot to mention too, I actually, during the pandemic, we're all a little eager, we're bored, life is changing. So at this point, I thought sports nutrition was kind of missing from my life. And that's where I brought in my private practice to kind of include that more. I'm not seeking out patients or clients through that, but as people want to come to me, that's where the positive aspect of a private practice comes into play.
So from blueberries as your starting point to where you are now. So this also speaks to some of the opportunities too, like I was saying before, about how we can navigate the profession as a whole. So you're working in a full-time capacity and you're also
Mhm.
doing private practice. And
Yeah,
that somehow, we have to, you're an entrepreneur or a solo practitioner or whatever the case may be, with understanding how to fit all of this in. So you can provide, if you can you provide us with some guidance as to how you do juggle all the things that you do currently? Like, are certain things within a certain time frame, or are you only seeing private practice clients during a certain day of the week? How is that working for you right
sure.
now?
Yeah, I think that's a great point to make because too, during the pandemic, we all kind of backed down. We started saying no to things. I said yes to some new things, but I think over the past few years, I have really gotten to a point of where's the balance. I'm also a big volunteer with our academy level groups at the state level, local level. So I was doing a lot already. And after this past year, there were just things that I kind of had to step back from and say no to. And what really brings me joy? What do I enjoy doing that I want to give my time and attention to? That's going to challenge me. And that's going to give me that passion or allow me to fuel my passion for our profession, for the consumers that we're guiding to. Um, so with that, I did kind of set some standards with my private practice, definitely afternoons. Obviously I couldn't do it during my full-time work hours. And I did say, certain days. Or I said, if I do it on the weekend, if that's the only time my client can meet, this is the time frame I'm going to offer. And that's kind of what I can do for you. So I did set some boundaries for sure. There were definitely times it kind of got a little out of hand, and I just would kind of reevaluate, reassess, and say, all right, we got to take care of ourselves too. We can't do everything for everyone. We can't be perfect at everything. So, that's where you just really have to continue to reassess, reevaluate, look at what's working for you, what's fueling your passion. One thing for me was I'm not a big social media person. So posting on Instagram was like a chore. And, as much as I had all the stuff going through my mind, as best as I could, I would get it in my phone, make a post or whatnot, try and be ready to make those posts continuously. But it just wasn't something that I really was feeling I was getting any benefit from for my practice. Or, others would comment on it saying, this is great. All your information is great. Did I have to do it as often? Do I have to do it as often? No. So that's something I did pull my energy from was posting on social media.
Social media is not like it was even 2 years ago. Everything seems to have changed with the quote unquote algorithms and what
Right.
social media platforms expect from people who are on there. And the content creation of it all is like, what's the purpose if we're trying to drive traffic or gain clients out of it? It's going to be a flipping full-time job just trying to
Right.
maintain all of that, to be,
Right.
on all that time to kind of bubble up in people's feeds. And like you, I am exhausted. I'm just exhausted. And it's a free service that we provide. So it's an extension of the marketing of what we
Right.
do, or at least just to have a presence in some way. And so if anybody's listening to this and you are curious about the people that you follow, this is what goes on behind the scenes. We might not have social media managers in our team. We might be the only people doing everything. And it really is quite time consuming, especially if you want to be super savvy at it with, what's the
Right.
reels and the dance
Yeah.
videos and all that stuff. It's just, who has the time, Emily? So I'm feeling like that too. I felt like I came in quite hot in the very beginning. Also, because hello, it was
Yeah.
like I had nothing else to do, for a while there
Right.
when
Right.
work was at a bit of a standstill for me at the height of the pandemic. And now it just feels like, thank goodness, business is picking up in some ways
Mhm.
for me that I feel like I'll get on it when I get on it, but I
Right.
can't really do it anymore. When I think of what you were talking about with the sports nutrition clientele and the oncology patient population, these are two areas of specialties that I think, at least in my internship and even in some of the curriculum, like the textbooks and things that we were
Mhm.
being taught in our schooling, we didn't really go too deep into.
No.
So can you share with us a little bit about maybe what the similarities or differences are? Because it's possible that people might have more than one interest in whatever their career pursuits are, but also how are you gaining knowledge to be able to focus so much onto I feel like they're not vastly different. Like, I feel like I can see some connections with what might be
Sure.
requirements for certain populations, what you need to know and what you've come to learn about those patient populations.
Kind of guiding to the students or anyone else listening that's interested in those areas. In order to get into those areas, it's experience. You really have to have that kind of basic couple years experience as a dietitian. And me being in the field for 11 years or so, plus or minus, it's taken me a few years to get back into the sports nutrition or to want to get that experience. Now, in today's world, I feel like sports nutrition, when I did my master's degree, there really were minimal programs out there and not a lot of additional experiences within sports teams. It was almost like as soon as I graduated, as soon as I was a year or two in, they just exploded. Now there's fellowships. Now they can't even fill some of the positions for dietitians for those roles. Some of that is pay. In another realm, it's because that's such of interest to many people. You might have athletes now who want to be a dietitian and that's what they want to get into. And that's, of course, an area initially I wanted as well. It just wasn't there yet. It just hadn't grabbed. I hadn't made some of the connections maybe that I could have. Maybe moves would have been important. At that time of my life, I just wasn't ready to make a move anywhere. So those are things that if you're getting into those areas of sports nutrition specifically, definitely be willing to maybe make those moves early on, to take some of those risks, to do fellowships and really get that experience. I think too, though, you need to have that kind of basic dietitian. I don't want to say clinical because outpatient, even though it's very clinical, I think I do sometimes more clinical work than the inpatients at the facility that I work with, and nothing against them or anything like that. But it's so much more in depth because in oncology, then you're looking at all different types of medications, knowing kind of what they're used for. It's a lot of symptom management in oncology. So again, that kind of comes from knowing basic clinical, why are labs, altered right now, but add on now they're getting chemotherapy, they're getting radiation. What else can we do for them? What is the dietitian going to recommend now? So getting into it, experience is such a key. And then learning myself, what I've done is I have definitely done webinars, CEUs, continuing education for the newies, looking at what can I grab? And I would say the first couple of years I was doing a lot of sports nutrition runs because that's where I wanted to go. Now you've kind of focus in on what's your niche or what do you want your niche to be? And that's where you focus your energy on learning a little bit more. And to add to that, then the learning a little bit more, I have learned more from a multidisciplinary education realm than in a dietetics realm, if you will. Not because dietitians don't have that knowledge, not because we're not providing that, but in order for me to provide the best care for oncology patients, I need to know what the oncologist is recommending, what the radiologist is recommending. I need to know what the pharmacists are doing with their medication changes. I need to know if they are going to PT or getting rehab of some kind. I need to know all those things, or their surgeries. So I need to talk to the surgeons. So learning about the background of kind of more the medical management of oncology really helps me be able to know how to do my job better. One, it might be faster care, which is very important for oncology because we want to prevent malnutrition. And malnutrition can lead to so many more admissions to hospitals, which can increase hospital costs then, and then further their health. A lot of patients in oncology, they don't die of their cancer, they die of malnutrition. So if we can help with that at early stages, and I'll just give one example, head and neck cancers. That I am, as soon as I know someone has a head and neck cancer, I am involved. I'm talking to the oncologist. I'm figuring out if they're going to have surgery. I'm figuring out if they're going to have chemo and radiation, because then I know I really need to implement some things immediately, no matter what kind of status that patient is in, most likely. So really getting that multidisciplinary education has helped. In my healthcare system, we actually have an association that's all medical providers within oncology. And every year, probably since probably for the past 5 years, I'll say, I have gone to that conference. I have learned the most from that conference, or I've at least made connections where we can continue to improve our care. Maybe it's survivorship care, maybe it's preventative care, but in that realm, that multidisciplinary education has really helped me. And it's given me the passion I want to continue in that realm as well.
This is so important because it helps with advocating and advancing the value of a dietitian to be in
Yeah.
those discussions because like you
Yes.
said, it helps us do our job better. So this brings me to, have you hit up against any resistance from other healthcare providers who might seem a little dismissive or not entirely sure why you need to be looped in? Because, we're just talking about food, as some people think, but really we're there to manage people's conditions and also behaviors and resources and so on. So, what are some suggestions or what are some ways that you've been able to make sure that you get the value of a dietitian recognized in these discussions or in these multidisciplinary teams?
That's a great question. I am also on a committee. It's our kind of national oncology nutrition committee within our healthcare system. So many colleagues from around the country, we talk, we communicate, we do projects, and we're really trying to showcase what can an oncology dietitian do. Now, as I've mentioned, many of us, we've connected through that national association that's multidisciplinary. We kind of have gotten the word out, and that's where I have learned a lot from, is from connecting with those dietitians who already had connections. So connecting with them, being able to bring that back to my facility to educate our providers, doing educations with like the medical students, the residents, being able to showcase what we can do there. Doing it with PAs, nurse practitioners. If you can get out and do educations, in services, whatever you might want to call them, they don't have to be long, 10 to 15 minutes, just to kind of showcase, hey, these are the updates in vitamins and minerals during cancer care, or these are the updates in the symptoms that we're managing. And hey, here's a new medication or something else that we tend to recommend that we're finding is working really well for these patients. I have found, in specifically where I work, just my presence within that service, within being able to be referred to so easily and easy access, has enabled them to see the benefit of me. We're actually, and I think many facilities, healthcare facilities around the country, talking to another friend of mine who's a clinical nutrition manager, and they are just looking at clinic utilization in the outpatient sectors. And with that, you have to show like how many patients you're seeing a day. But we know as dietitians, it's not about how many, and I'm sure other, healthcare providers can attest to that. It's the quality of care you're giving, and it's all the other little things in between. So when I'm talking about a head and neck cancer patient who's going to get surgery, I have a lot of coordination of care, and that takes a lot of time. So doing all of that to kind of show is so hard. So I'm finding the hardest part is not the other providers you specifically work with on a day-to-day basis. It's kind of that higher level of management that needs to understand the benefit of having a full-time oncology dietitian, or maybe you need more. And that's something that my committee is working on, is we're trying to figure out that kind of FTE number, dietitian per patient ratio. What is it that we have? And there's studies out there that show some suggested numbers of like one dietitian to 120 patients, but we don't have a concrete, knowledge of that or kind of look at that. So I think really in healthcare, those are kind of the things that we're trying to get to. And it's showcasing to management, whether it's your direct manager, way above management, whoever it is, if you're in a large healthcare system, it's really showcasing what that benefit is, and not necessarily in that kind of clinic number. It's what else can we do? So I think that's the challenge right now, is how can we get more, whether it's oncology, sports dietitians, whatever it is, how can we get more of those specialties, and why? Why do we need it? And that's where, as a dietitian, we really need to just be present. We really need to showcase our skills and not act like a know-it-all. I think that's something that with newer dietitians or the students coming in, really just allow yourself to hear what seasoned dietitians have done, hear their experience, and not expect yourself, if you're 2 years in or 5 years in, to know everything. Be able to learn and keep learning. I mean, that's what our continuing education is for. And I never feel like I'm the expert in anything. I might have like a little edge on some of my colleagues, but I'm always open to discussing with them and saying, hey, tell me what you think. If you're seeing a patient, I want to hear what you think. And if you want me to give you feedback, I'm happy to do that. Otherwise, you're a dietitian. And so probably what you recommend is going to be appropriate for you.
This reminds me a lot of what I tend to encourage because I teach as well undergraduate and graduate nutrition sciences, and especially for dietetic interns or people who are in the grad school program or potentially going to go to be in dietetics. And what I try to encourage them to do is not just focus solely on the textbook of it all, is to make sure that you are getting out there and networking, joining Facebook groups, but not just within the dietetics world, as you mentioned, more other professionals as well. I love following social workers, mental health
Yes.
therapists. Like, I really
Yes.
love listening to the
Hmm.
language. They're very also in line with a lot of how our reimbursement works as far as health insurance too. Like, they have certain things that they're dealing challenges as well that they're dealing with certain diagnoses and what's covered, what's not covered. So I really love listening to the language, and especially the private
Right.
practitioners. So that is kind of built in for you with the oncology patient population. What about as a private practitioner in the sports nutrition patient population? Who are you networking with there, and how are you marketing your services to, in that particular world?
Yeah, I think that's the challenging aspect, is because I'm kind of on my own. I'm not connected to maybe it's a smaller business who has a couple other providers. You mentioned social workers. Some of my, I'll say, best friends, good friends, or colleagues are social workers, and I love working with them because they have such knowledge. I had no idea what social workers did before I worked where I worked. I mean, I just thought they were, there to help with food security, but they do so much more. And I think that's kind of, then flip it, is we need to be able to showcase what we can do as dietitians. So with the sports nutrition, it definitely has been a challenge, especially in the area I work, where I live. You've got your personal trainers, your coaches, and anyone else out there, moms, whoever, who just have the experience of, hey, I was an athlete, or hey, I train you to lift weights and do these things, athletic trainers. And that's understandable on a basic level. My plate, the balance of what you should be eating, yes, they can kind of guide you on that. But it's when it comes down to the specifics that every athlete is going to be different. And that's kind of what I post on a lot of my social medias, is every athlete is different. Every recommendation is going to be different, because you might be a triathlete. Okay, well, you might have two practices a day from one sport to another. That's totally different. Your needs are going to be totally different than someone that's just a one sport athlete, that might be swimming versus volleyball and soccer. Those are totally different sports, totally different needs. In general, most of the time, because I work with more adolescents and then college athletes, they're not eating enough. So to get that message, going back to your question about, gaining that respect, gaining those referrals, it's been a challenge, because I think those other areas think that they can just do it as well, or that because they're already seeing them as, and I'm going to use a personal trainer, no offense to any personal trainers, I know many, but if they're already going to a personal trainer, okay, why not we just kind of double up and I'll showcase what you can do for your nutrition. When I worked at the YMCA, it was, hey, personal trainer, I want to eat what you eat because I want to look like you look like. And that's so hard in our society, and where I bring the intuitive eating practices in. That kind of grabbed my attention right before COVID, and then I became a counselor through the intuitive eating professionals. So bringing that into why we do what we do is so important, and also to really showcase that to our area. And my area for sure is, what's the media saying? What are these diet books saying? And it's just been so hard to get out there. A lot of my referrals really just come from, they found me online, or maybe there was a coach I was working with before. So I have connected with coaches. I try and connect with athletic directors and just say, hey, I just want to come and do a team talk, honestly, no cost. Just let me come and introduce myself. I've worked with club teams before and just gone and educated. I've done some soccer camps before. So having those connections has given me the referrals. And that's kind of what I'm here for. I'm not looking to work with every athlete on a team, although that would be great. But if we can just get those connections and, hey, I'm a coach, I'm seeing this student of mine kind of struggling a little bit, maybe I need to refer them to the dietitian and see what's going on, because there could definitely be an underlying eating disorder. And when I started to get into the sports nutrition, that was what I kept hearing was, you're going to see a lot of eating disorders or disordered eating. And now we're seeing so much of orthorexia, which is not a professional term that we use or a medical term, but it's the obsession with healthy eating. And with using that, we're seeing athletes under fueling. And as a child, an adolescent, and even a college athlete, we really have to focus on the long-term effects of that, whether it's hormonal in the females or bone density in males and so much more. Those are just a couple areas, but we have to look at those. And that's where I think really dietitians can showcase what they're doing. But I just feel there hasn't been a platform because everyone else goes to personal trainers, goes to athletic trainers and the coaches. And again, nothing wrong with that, but we really need to use the experts because there's underlying other health issues going on that a medical nutrition therapy used by a dietitian is really important to have.
A lot of the language that you are using currently has come up in previous episodes, but in case anybody is unaware or hasn't heard some of those things, so just to clarify a few things that Emily was talking about, we have what's called the scope of practice, meaning that everybody is trained to do a specific something in their field of expertise. When it comes to people who do work in the fitness world, they usually do have some sort of understanding, as do medical professionals, medical doctors, some sort of general understanding of nutrition.
Mhm.
And as Emily was saying, they can prepare a meal plan for someone, but they don't necessarily know the nuances on a micro level, or even to notice patterns of behavioral issues that might be affected or that are ending up affecting the outcomes of what these
Mhm.
choices that people are making. So that's where dietitians come in. Now, I will say on a state by state basis, this is vastly different. So some people can, quote unquote, get away with administering nutrition advice no matter who they are. Again, like you said, no offense to personal trainers, no offense to people who work in like the vitamin shop or the health food store.
Right,
These are
right.
not necessarily credentialed professionals with a degree in nutrition as the dietitians are. Other states are stricter on their policies and regulations, in which case then they can't do anything. They would have to have a dietitian come in, or you as the patient or the client would request to be referred to one. So that's one thing. Orthorexia has come up in some of our discussions previously too. So like you were saying, not necessarily a technical official term just yet, but this obsession with healthifying the diet or making sure, quote unquote, clean eating. Since you have
Mhm.
two patient populations where appetite could be affected, and now to implement, I think we might have talked about intuitive eating
Yes.
is what you were mentioning before, which is technically, as it is stated, you could be certified in intuitive eating. It is a set of principles to help people kind of detach from a morality or help with healing their relationship with food, but also
Correct.
generally speaking, as far as healthful habits. So would you be implementing that also with helping people who are recovering or are currently in their oncology treatment? And would that be different than if you're working with somebody who's driven by performance or making weight in your sports population? How might you implement intuitive eating in either one of those cases?
Yeah, I think there's a lot of similarities with it because you mentioned there's principles. And yes, you don't have to be credentialed in it or a counselor officially to do intuitive eating. It's more the principles behind it, especially with my oncology patients. And then again, it kind of wraps in those sports nutrition patients, is that we want them to have a good relationship with the food they're eating. And in oncology, they're probably going through taste changes. They're not hungry and have no appetite. But then when you see them, they might say, oh, that pasta tasted so good last night. And what I will encourage them to do is, I want you to find the foods that you think taste good. Because at this point, yes, we are trying to prevent malnutrition. And there's ways that if you're only going to eat pasta and red meat, for example, and maybe one vegetable, hey, that's a balanced plate to me. I don't care if it's the same right now. I want you to enjoy your food because of everything you're going through. I want you to have that taste because there's other foods that don't taste good to you at all that completely alter your appetite and cause you then to not eat, which is going to cause you to lose weight and then further that malnutrition if you have it or if not. So we really encourage that satisfaction of foods with the oncology population. We're of course, like I said, we're looking at the vitamins, the minerals, the balance of their plate. The oncologist, the one I work with, he loves to say, just eat the ice cream. And I will never say no to that because, yeah, great. There's fats, there's calcium, there's protein in there. Great. Go for it. But we want to, yes, include, okay, is there a fruit that you can eat? Is there some kind of a vegetable that you can have? Maybe if you're having a milkshake, maybe we can kind of put some spinach or kale or something in there to get a vegetable. Now, that's a very rare recommendation I make because I work with a lot of older population people and they kind of turn their nose to that. So we work on other arenas to get that satisfaction from food. When then we look at the sports nutrition world, that's when we're seeing more restriction of foods. So people are not eating chocolate. They're not eating a donut. They're not eating maybe even pasta, for example. Well, what if you really enjoy that food? And guess what? It's fueling because it's carbs, and carbs are your friend for all athletes. So, why can we, or how can we include that food? And yes, keep it controlled. Maybe the more you eat it, the more you're not going to want to overeat it. So, if we include that in your diet, maybe it's every other day, maybe it's every day, you're going to realize over time that your body was just restricting it for so long that you craved it so much. And that's why maybe you ended up overeating it. So you just said, forget it. I'm just going to not even eat it anymore. And then you just don't have that satisfaction again. So are you forcing yourself to eat chicken, rice, and broccoli? Come on, we all know those are common recommendations from certain people for what's going to make you lean and give you energy. But doesn't that become boring over time? Then it becomes a chore to make chicken, rice, and broccoli. I'm going to bring in a personal experience here. As a dietetic intern, I was food insecure. I spent $20 to $25 a week on food. I, had my own bills and all of that. I literally ate the same food almost every week. I might have switched up the celery for carrots or something like that, but I had sweet potatoes. And I was just thinking about this yesterday. I had sweet potatoes almost every week, or at least for a very long period of time, because a bag of small sweet potatoes was very inexpensive. I have sweet potatoes. I made them. I didn't want to eat it the other night because you know what? I think back to that and I ate that food so much that now I don't want it. So when we look at sports nutrition, when we look at under eating, under fueling, when we're restricting foods, yes, we might then go to overeating that food. But if we get to a happy medium place, and you mentioned it before, Dina, was we want this healthy relationship with food where we can have unconditional permission to eat all foods that we would enjoy. So if I can get to a point where, okay, I know I ate sweet potatoes for so long, maybe I can enjoy them with, sure, a little cinnamon and brown sugar on them because that's what's going to get me to eat them. And I enjoy them that way. And that's okay because I'm getting so many nutrients from the sweet potato then, but I'm not eating them plain and boring like maybe I did when I was an intern. So maybe it's flavor profile with the foods. That's another thing for satisfaction is how can we get this food to be satisfying? In oncology patients, I'm looking at is salty or sweet tasting good? Maybe both are. Are you tasting more bitter or sour? How can we kind of look at the satisfaction of foods, which is one of the principles, and really tune that into our recommendations. It's not always about the ABCs of nutrition. It's about how can we nourish the body in ways that we enjoy that's going to fuel our body correctly and appropriately and balanced.
Yeah, that's so important, especially when people are recovering from something or living a life where they are feeling that the enjoyment has been taken away from them. So to be able to reintroduce
Hmm.
that and allow
Hmm.
them to have that flexibility, that freedom, that variety. And maybe it's just a handful of foods that seem appropriate or right or
Right.
that they really are drawn to, but that's okay. That's okay to be able to do that. So I love the approach to all of that. I wanted to ask you too, Emily, whether whatever realm that you want to pull this from, is there anything currently that gets you heated up about anything, whether it's career stuff or patient population or chronic conditions, any hot topics, any disinformation, misinformation, anything that you feel like you want to address?
I think right now, and I forgot to mention this earlier when we were talking about, like getting ourselves recognized. I think reimbursement right now has really gotten me a little heated because as dietitians, we only get reimbursed for chronic kidney disease and diabetes. So if someone's in private practice or wherever they might be working, their facility or themselves are really only getting reimbursed by insurance for those two conditions. Now we have a general code that we can get some reimbursement from. Most insurances probably might have that, but they're probably only allowing you one visit per year or something for that. In most medical diagnoses, you need at least a couple, follow-ups within the year just to check, make sure, if there's lab work, if you're having GI issues, we want to check a lot of labs to make sure you're not deficient in anything. So having those couple follow-ups is important. And with reimbursement, we just don't have that. So there is an act right now, the Medical Nutrition Therapy Act, that's been trying to get passed for many, many years, I think since 2010, if not before that, that we're really trying to pass right now. That's going to include a plethora of other diagnoses, including GI, including eating disorders, including cancer patients. So if that gets passed, I think that would be so much more beneficial for dietitians. And then going with the healthcare model, give facilities more monies to be able to pay for their dietitians. Because that's, I think, the big thing is facilities are like, well, we can't pay for you to be full time, or we can't pay to have another dietitian just do oncology or whatever it is. So having the reimbursement and again, continuously putting us out there to show what we can do really is going to help our profession in the long run. So I think right now, physically as of today, I think that's my one gripe.
This aligns exactly with a handful of conversations that I just happened to have this week. So I had another recording with a different person from the physical therapy world who only does self-pay. So that's going to be Dr.
Yeah.
Matthew Brown in case this is published before or after that. And he was talking exactly about that. He's like, by the time you go through the deductibles or the co-pays or how many sessions or what the actual treatment plan is, and then it deters him from being able to give quality treatment plan to his clientele. So he's like, he refuses to do it. Mental health, we were talking about that earlier. Mental health professionals also have specific
Hmm.
diagnoses, or they're only allotted a certain amount of sessions, and you can't fix certain behavioral issues in a very short
Right.
time, just like what
Hmm.
Emily was saying. You can't fix or manage certain chronic conditions in 3 sessions, which is redonkulous as far as I
Hmm.
am concerned, and you are as well. So if you are listening to this, whether you're going into the health and wellness world, take that into consideration. I mean, those of us who take health insurance or are credentialed to be in network, we want to do it to have our services be more accessible to our patient populations who are underserved, can't afford paying out of pocket.
Right.
But also, you as a patient, write your representatives. Look to see, this is an election year as we're talking. I just got done talking about this a little while ago in an Instagram live. See what the priority agenda items are in your state, in your community, nationally speaking. What makes most sense for you? What do you think is important? And then vote for the people who can make those changes,
Yes.
because we can only do so much.
Hmm.
Like you were saying before, it's 1 to 100, like one dietitian to 120 patients. That is a lot for somebody to juggle, my friends. And if you
Hmm.
look at what is it? Like, I think 1 million medical doctors, 2 million registered nurses, and then like 110,000 dietitians. It's just, we want to be specialists. We want to be available,
Right.
but we can't. And as you just mentioned, some people will not be able to afford to pay us or have us do a per diem once a week, and then
Mhm.
we can still only see a certain amount of people in that time,
Right.
when it would really be so beneficial for everybody, even just to come check us out for a handful of sessions, just to get you up and
Yep.
off if there's nothing really super serious or that you're just learning preventative measures. But if you have a specific
Exactly.
condition, like we want to be there when you go to your next physical exam or when you go to your next blood test. We want to make
Yep.
sure we're there to review everything. So, yes, everybody get on board and advocate
Yeah.
for our.
Exactly. And advocacy, I would say, is a huge thing that I've learned in this profession. We have to do it because there are only 100 and however many thousand of us or whatnot. We need to be the voice. And if so many of us, I mean, I'm going to say, out of the dietitians I work with, I'm probably the only one who does anything about licensure and advocating. So it's so important. It seems like it's a lot, but it's not. Get started with action alerts and just do those. And like you said, contact your representatives, your congressman, send them an email. They love hearing from you and they might reach out to you. Be that person that they can go to as the expert in nutrition. Don't allow those other people to go be their go-to. You are the expert. We're the dietitians. We're the ones that should be giving that information out.
Yes, and I love whenever I receive any of those kind of done for you petitions where the wording, the language is
Yeah.
already there. It's like, as a constituent, I'm so
Yes.
grateful that somebody's done that. But I always go in and I'll put in and a registered dietitian or someone in the health and
Correct.
wellness profession. So yeah, so and this way too, Emily, right? Our voices make a difference, I hope, and we can't necessarily complain if we didn't take a minute
Right.
to
Hmm.
advocate for change, whether we're talking about us as a profession or just general citizens of the world, that
Right.
hopefully you vote and you make your voices heard, and hopefully things will come into play. I want to ask you a couple of things. First of all, a current week in the life of you with all the things that you're juggling, how are you managing your own health and wellness needs? Like, where do you fit in? We talked a little bit about boundary setting before and
Yeah.
administrative tasks, but share with us a little bit about like how your week works and what's a non-negotiable for you.
Sure. I definitely try and get up and moving during my work day. I set calendar reminders every day. I don't care if they go off and I can't do it, but I set those reminders so I can get up and move because there are some days where I don't have time to go to a gym. I practice what I preach too. If you don't like going to a gym that day, don't go to the gym. Maybe do something at home. Maybe you just take a walk. Find things you enjoy. I think that's what I've learned over the past few years is I used to love going to the gym. I used to love lifting heavy, working out, doing high intensity classes. I do not enjoy that anymore. My body doesn't enjoy that anymore. And it's not because I'm getting older. It's just I don't really enjoy it. So learning to take our years maybe as we get older or whatever it is, if our bodies can't do what we used to be able to, understand that, move with it, and just find the joy in finding your wellness. um Cooking, I try and meal plan. My husband and I, we try, but some days it doesn't work, and it's just finding that balance again of, okay, I need to have a vegetable with the pizza. Let's make a salad so I can at least feel, like I'm nourishing, giving myself some fiber, at least feel a little more full than just having half a pizza. Maybe I'll have only a couple slices now because I had a salad. So the balance is real life. And we hear it every day as we counsel patients. I understand what they're going through. I understand a busy life. I don't know how moms and dads do it with two, three kids in all different sports, my sister being one of them. I don't know how they do it. I don't know how they balance it. So it to understand what they're going through is one thing, but then to give recommendations, you do have to sit there sometimes and think, all right, what's going to work for you? Yeah, let's talk through this because that's a lot going on. So I have to do it just as much as I counsel my patients. And there's days where, I don't get to eating until late at night. Well, maybe then I just don't eat as much because I know it's late at night and I know I'm probably going to bed pretty quickly after a Zoom call or something. So a lot of balance, a lot of planning, and a lot of what I practice and preach.
I think that's so important. I mean, we were saying before we officially started recording that we are also people and humans and patients
Mhm.
ourselves. And so for us to I don't love the word motivate. Like, I'm not motivated necessarily to do certain things, but I definitely try to commit to and prioritize certain things that I know are
Yes.
very important in my life to maintain my own health and wellness,
Yes.
mental and physical as well. So sleep, is a big thing for me. I cannot stand when I have to put in an all-nighter, or as I'm coming up on my fall semester right now, I have days where I'll be teaching until 9 o'clock at night. And by the time I get home, it's 10:30 and I'm just going to be
Yeah.
miserable. Like I already know that. I'm trying to think of
Yeah.
ways like, how do I end the class early? So things like that, I want to work on. Emily, or is there anything that we have not discussed or any questions that I did not ask you that you'd like to share with our listeners?
Oh, I that's a very wide question. Um, Maybe the only other thing, and I've done a couple presentations on this in the past year with one of my colleagues that I work with, is in the cancer population. You know, we see a lot of actual maybe orthorexia and kind of that obsession with healthy eating sometimes in oncology patients. More, not so much with the patients I work with, but definitely in like the community sector where they're obsessed with juicing, they're obsessed with, you know, only eating certain foods, and these are diets that have been put out for the oncology population that they are following, but there's no evidence that these work. Now what I will say, I have a patient right now who was like, I'm going to eat the cottage cheese, the flaxseed, the oil, I forget what all is included in it. It's not that those foods are bad, and I don't like using bad or good foods anyway, but it's not that those foods you can't eat, but why are you eating it? Do you enjoy, again, that satisfaction? Do you enjoy eating that food like that? Like in a smoothie or like mixed together? Like maybe just have the cottage cheese on its own with the flaxseed if you like it that way. You don't have to put the oil on it, get the oil somewhere else. So when we see this obsession or this focus on the healthy aspect of oncology, and yes, all these antioxidants are great. Yes, I'm going to want you to eat fruits and vegetables if you can tolerate that, because we do know they're beneficial. But when we put it to the other realm of, I have to lose weight, I can't gain weight during cancer treatment, that's such a huge area because we are in such of a weight bias arena in the past few years. I think especially it's really erupted, um, where the BMI, we need to change it. And some things I've read, I agree. Use it as a baseline. Use it as, okay, it's a guide. Let's start here, but let's dive deeper into why. Why is your BMI that way? Why did your BMI all of a sudden go up 10 points in the past year? Those are things that aren't all behavioral. We know behaviors are definitely going to impact it, but there's probably some other medical condition going on. And especially in oncology, you really can't change what's going on. If you're going to gain weight because you're on hormone therapy, you're going to gain weight, and there's nothing nutritionally to starve yourself that you should be doing to prevent yourself from doing that. That's what your body's meant to do right now. So really focusing in oncology now on health at every size, if you will, making sure that patients understand that it's okay to gain that weight, or if you are gaining weight, what can we do in that kind of therapy session, if we can refer to a therapist, a psychologist, what can we do using intuitive eating principles to have them give themselves a little bit more respect and kindness of what's going on with their body. And it's okay. The weight is just a number on the scale. And if you feel great one day, even though you have gained 10 to 15 pounds, feel good that day. Go on your walk, go for ice cream with your friends, go to an amusement park, whatever it might be. Get out and do those things, because tomorrow or the next week you might feel like crap. So what can we do to invoke a positive experience through the oncology population, and not the focus on weight necessarily on the positive realm, and on the negative realm too with malnutrition.
Yeah, I mean, clinically speaking, yes, we understand there's going to be significant or severe changes in body weight within a certain amount of time that could be very concerning. And that's its own discussion, obviously. But then your body might be trying to heal itself, and this is the way that it's
Exactly.
happening. And so
Yep.
you, thank goodness, are there to monitor and help guide that discussion as well, to kind of separate out what the attachment is to body size and
Correct.
body image
Yep.
versus this is the new state of health for you, and we are going to try to, manage that in that particular situation.
Yeah.
Emily, my final two questions for you, or my two-part question, is what is on your plate today? So, as soon as we wrap up our conversation, what is the next thing that you are going to be working on or doing? And then, what is the next meal that you're going to be eating?
So what I will be doing after we get off this call, ooh, I don't know. It's supposed to rain here in a little bit, so I might go soak up some sunshine. And then what am I going to eat? I think we're having leftovers because last night I didn't eat what we made because I just wasn't as hungry. I wanted something lighter, so I had a salad with cottage cheese. I know that's weird, but I had a salad with cottage cheese. And so tonight I'm going to have shrimp with the homemade pesto and I think some pasta, maybe if I want the pasta. So, and a vegetable, I think broccoli or Brussels sprouts, one of the two.
Emily, this has been a true pleasure getting to know a little bit more about you, to dive deeper into some of these discussions that I don't think we really got a chance to talk about in some of the other episodes on this podcast. So, thank you so much for sharing your expertise and your insight and having a great conversation.
Oh, yes. Well, thanks so much for having me. I'm glad we could connect and glad I could be. This is my first podcast. So I'm glad I could be on here to share some information.
Thank you so much.